This is a story of Valentina's visit to the hospital. One day, Valentina was riding her bicycle. She was smart to wear a helmet. Oh no! Valentina had a fall. She hurt her leg. Her friends were clever. They told their parents right away. Emergency services were called by dialing 911. EMTs arrived in the ambulance to help. It was decided that she needed the care of a doctor. The EMTs took care of her and drove her by ambulance to the hospital.
Dr. Bruce, telephone, please. Dr. Bruce, telephone, please.
After intake, the patients have been triaged. Patients with the most urgent needs are seen first. The ED is busy. Valentina will be one of many patients treated today. Together, let's help the ER doctor evaluate Valentina and her next two patients.
Dr. Blair, Dr. J. Hamilton, Dr. J. Hamilton.
Patient 1 is a 7-year-old female with leg pain after bicycle fall, wearing a helmet. The physical exam includes gathering the patient's vital signs. Vital signs provide critical information about the patient. A light is often used to look into the throat as part of the examination of the head, eyes, ears, nose, and throat. This can be written in the medical record as HEENT. When a patient has a fall, doctors want to be sure there is no injury to the neck or back. The cervical spine, the neck, and back is non-tender to palpation. This means the neck and back do not hurt when examined. A thermometer is used to measure body temperature. A fever may be a sign of a problem in the body. The patient has a normal temperature. To auscultate is to examine a patient by listening to body sounds. A stethoscope is the tool used to auscultate. Heart sounds reflect a regular rate and rhythm, meaning these heart sounds are normal. Blood pressure is often considered one of the vital signs. An abnormal blood pressure could indicate a problem. The patient's blood pressure is normal. An EKG displays an electrical signal from the heart to check for different heart conditions. The patient's EKG is unremarkable. After the exam, the patient will be sent to radiology for x-rays. We will see your x-rays soon. Next patient is a 28-year-old expecting mother at 17 weeks complaining of fevers. Fevers began 2 days ago. She denies pain, cough, or decreased fetal movement. To evaluate the fetal heart rate, tap here on the screen. The fetal heart rate is much faster than an adult, and changes may indicate illness. An ultrasound scan is a test that uses a high-frequency sound waves to create an image from the inside of the body. It's also known as a sonogram or sonography. An ultrasound scan is a test that uses a high-frequency sound waves to create an image from the inside of the body. It's also known as a sonogram or sonography. The mother is afebrile and in no apparent distress. The OB will want to see the patient as well. We will consult the OB service. We have a patient waiting. Patient is a 49-year-old male with a laceration to the left arm with minimal active bleeding. Laceration, a cut or a wound on the skin. We need to suture and dress the lac. I will act as your attending physician and guide you. We need to suture and dress the lac. Irrigation and exploration. Rinse and remove dirt. Wound dressing for protection. Nice work, doctor. Next, I will send you to visit the attending physician in radiology, where you can catch up with Valentina's case. There are several studies waiting in the queue. These are Valentina's studies from the emergency room. Patient is an 8-year-old girl that had a fall from a bicycle. Tap to review the images. The patient complained of wrist pain from the bicycle fall, so the ER doctor ordered x-rays of the hand to ensure there are no problems. Click the INV button to invert the colors to help detect any fractures. There are no apparent injuries to the hand or wrist.
Interesting. Take a look at this.
Compare the knee on the left with Valentina's knee on the right. Click the INV button to inverse, change the colors to help detect any fractures, also known as breaks, in the bones. Do you notice Valentina's femur has concerning findings?
That leg will need surgery.
The ER doctor ordered x-rays of the head to ensure there are no problems. This image appears normal. The ER doctor ordered a fast MRI of the head to rule out injuries to the brain. I'm glad the patient was wearing a helmet. Wearing a helmet helps to protect the head and brain. There are no apparent injuries to the brain. The study is normal. We have more studies in the queue from other patients in the hospital. There is one image with a significant finding. Do you see it?
Interesting. Take a look at this.
Notice the back has a curve. The back is normally straight. This condition is called scoliosis and can be a problem in people. This x-ray is normal.
Unremarkable.
An MRI machine takes several images of the body. This study is an MRI of a cervical spine, the neck. Patient is a 35-year-old female with neck pain. There is no abnormal finding in the study of this. Patient is a 20-year-old male with a bad cough for several weeks. There are no abnormal chest findings in the study. This x-ray is normal.
Unremarkable. Thank you for visiting orthopedic surgery. The surgeon confirmed Valentina will need surgery to repair her leg so the bones heal properly. The surgeon will perform an additional evaluation with a fluoroscope. We will evaluate the ankle and wrist to make sure there are no fractures that were not seen on x-rays. We'll use fluoroscopy for this.
Fluoroscopy of the wrist and hand is unremarkable. Fluoroscopy of the foot and ankle is unremarkable as well, but Valentina will need surgical repair of the leg. We will see her in the OR next. Valentina is in the operating room. The doctors used a face mask to help her sleep and stay comfortable throughout the surgery. During surgery, sometimes, we need to increase or decrease the heart rate to help the patient. Notice the heart rate change as you tap the arrows to administer medication towards tachycardia or bradycardia. When Valentina wakes up, she will be back in the hospital bed and her leg will have a cast. Valentina needed some time to recover. Over 4 to 6 weeks, she was able to have the cast removed. She worked with physical therapy and not much longer, she was writing again.